dear learners. Myself Bhavani Pentela, working as an assistant professor in Noida Institute of Engineering and Technology, Pharmacy Institute, Greater Noida. In this today class or today lecture 17, we are going to discuss about factors modifying the drug action. In the unit 2 with the subject Pharmacology-I with a subject code BP 404. So, without any further delay, we will dive into the class. So, what are the factors that going to modify the drug action? Here the lot of factors like body weight, age, gender, pregnancy, lactation, cumulation, psychological state, genetic factors, disease state, tolerance, race, genetic influence, route of administration, time of administration. There are lot of factors that which will modify the drug action. Now, we will discuss about one by one each. Okay. So, what the factor, first the factor was a body weight. So, the body weight is an important factor that definitely going to modify the drug action. So, the weight of a body also it can it can modify the drug action. For example, if you have to prescribe the dose, so what you have to do here, the dose to be prescribed which will be divided by the body surface area meter square to that of 1.7 into adult dose. If you have to calculate the dose of a particular prescribed, then what you have to calculate here, the dose to be prescribed is equal to body surface area divided by 1.7 and to the adult dose. And the second formula was weight in kg. So, you have to calculate the how much weight of the particular person which you should be divided by the 70, and you have to multiply with the adult dose. So, what the adult dose you are giving there and what the body weight of the particular person you have going to prescribe the dose, you have to divide with the 70 and you have to multiply with the adult dose, by where you can calculate the dose, what dose you have to prescribe for the particular patient. And next dose and next factor modifying drug action was age. Definitely age also will plays an important role to modify the drug action. If I am talking about the age here, we are having the three types of age like childhood, newborn people, children, infants. This will be categorized into one, and second one is adults and third one is elders. So, we are having, if you are categorizing the age into the three major types like children's, adults and elders. So, the dose what you had prescribed here, what the drug you are going to give here, definitely it going to alter in the children's and elder people. Why it is going to alter in the children's and adult people, children's and elder people? Because if I am talking about the children's, newborn people or the infants, here their functions was not fully developed. In case of newborn people, what is going to happen here, the glomerular filtration rate will be get decreased. So, the elimination of a drug will be get prolonged in the newborn people. So, you cannot increase the dose, you cannot give the much more dose to the newborn people. Definitely the dose will be so here the drug will definitely will alter the action. Definitely here the drug will modify the action, so what condition or what the state of a particular patient here. So, if I am talking about the children, here the function was not fully developed, and if I am talking about elder patients here which they having in a decline phase, all the functions has been declined. In such a condition also the drug is going to modify its action. For example, if you are giving the drugs, so what is going to happen here, the metabolic rate will be get decreased. So, the drugs cannot eliminated from the body as like elder person. So, if I am talking about the elder person, the metabolic rate will be get increased by the liver, by the enzyme inducers, the drug can be metabolized and it can be eliminated by the body. But what is going to happen in the elder people? The metabolic rate will be get decreased. Here the metabolic rate, what is going to happen if the metabolic rate has been decreased, the drug will be stay more time in the body, which can causes the toxicity effect. And what will be happens in this decline phase, the kidney also will not work as properly like adult patient. Here the lot of the drugs cannot eliminated from the body due to because of decrease or failure of renal function. So, while giving the dose you have to keep very caution in the children's and elder persons. And here there are the three formulas like Young's formula, Dilling's formula and Coving's formula. So, what the formula represents here, how you can calculate the child dose? You can calculate the child dose by the Young formula, age by age plus 12 into adult dose. So, what you have to do in Young's formula, how you can calculate the child dose? You can calculate the child dose by the age. how much age of the particular child it is, how much age, either it is in 3 years, 4 years or 5 years, and you have to divide with the age plus 12 and how much dose you are giving to the adult. So, this you can calculate, this you can give the child dose, how much dose you can prescribe to the child. This is an Young's formula, and the next formula was Dilling's formula. Dilling's formula is very simple here, the age divided by 20 into adult dose. So, how much age he is, for example, if the age of a particular child was 5 years and it should be divided by 20, and how much adult dose you are giving there, you have to divide with that adult dose, you can calculate the child dose, which is then a Dilling's formula. And next one is Cowling's formula. Cowling's formula here, age and the next birthday. What is the age here? The age, in sense you have to take the next birthday divided by 24, okay, and which you have to multiply with the adult dose. So, by this you can calculate the child dose, which you can call as a Cowling's formula. So, by these formulas you can calculate the dose of a child. And the next factor was an sex, gender. So, if you see here, there is no major differences of drug responses between the sexes like male and female. There is not much more differences, there is not much more difference of responses you can be observed within men and women. But you can see, you can observe a slightly difference, like the, if I am talking about the woman, the body surface area will be decreased when compared to that of males, right. If you are talking about the males are having the larger body surface area compared to that of women, in such a case the drug is going to modify the drug action. If I am talking about the drugs like beta blockers, so where you can use the beta blockers, you can use the beta blockers in the hypertensive patients, right. You can prescribe the beta blockers in hypertension, methyl dopa. So, if you are giving the beta blockers or methyl dopa or diuretic drugs, particularly in hypertensive patients, which will causes the sexual interference or sexual function, which will disturb the sexual function in the males. So, this is the modified action of any drug within the male and females. And we will move to the next modifying action was route of administration. Definitely route of administration is going to modify the action. In which way it is going to modify the action? For example, if I am talking about any drug which you had administered by the oral route and which you had been administered by the parenteral route, definitely the oral route absorption will be get decreased with the compared that of a parenteral route. Why? By the oral route of absorption, by the oral route of action, when the drug you had been administered by the oral route, the action will be get decreased, or the action will be shown slowly compared to that of a parenteral route, because here the drug will enter into the first pass metabolism. The main reason behind the drug which you are given by the oral route can causes the first pass metabolism, and this first pass metabolism will causes the action of a drug slow compared to that of a parenteral route. For if I am talking about this route of administration like digoxin, here I will take the example like digoxin. Digoxin is a drug which is used in a heart failure condition. So, if I had administered the digoxin in a oral route, so what is going to happen here? It can incompletely absorb. Here the absorption of a digoxin was being incompletely, because it will underscore. Here the absorption will be get interfered with the route. So, this is the reason why the route of administration also will plays an important role in the modifying of drug action. So, if I am taking the digoxin, if I am giving the digoxin, you can give the digoxin by the oral route or a parenteral route. If I am giving this digoxin by an oral route, the absorption of a digoxin will be going to decrease, and when I have administered this drug, in the IV route, the action will be very fast compared to that of an oral route. And the second example was magnesium sulphate. Magnesium sulphate, the drug is the same, and if you had given by the oral route or if you had given by the intravenous route, the action also will going to modify here. So, the magnesium sulphate, when I had given the oral route, it can cause as it can act as a purgative. And if I had administered the same magnesium sulphate by the intravenous route, and what the action is showing by the drug, it can causes the hypotension and it can causes the CNS depression. So, the route has been changed. So, here the drug was the same, what the drug here, the magnesium sulphate, the route was the different. What the route we are giving here? Oral route, and second one is the parenteral route. In oral route, what is going to show its action? When I had administered the magnesium sulphate by the oral route, it will shows the purgative action, and when the same drug I had administered administered by the intravenous route, it can shows the CNS depression action or hypotension action. So, this is the reason why the route of administration also plays an important role in modifying the drug action. So, we will move to the next one is diet. Definitely the diet will plays an important role to modify the drug action. Almost all drugs we can administer after taking of any food. Why we will give the drug after taking of any food? To minimize the irritation inside the GIT. So, usually when you had taken the drug on your empty stomach, definitely the drug is going to irritate the gastric. It can irritate the gastrointestinal tract. So, this is the reason we can administer the drug after the food to minimize the or to decreases the risk of gastric irritation. So, if you are administered the drugs at empty stomach, sometimes it can causes the nausea and vomiting also. To minimize this, you can administer drug with the food, but definitely the food is going to interfere or going to modify the drug action. So, here some of the drugs with food it can increase the drug action, and some of the drugs with the food interference of the food it is going to decrease the drug action. So, for example, if I am taking here an example like ampicillin, what the drug is going to do when I am administering the ampicillin with the food. Okay, here I am taking the drug ampicillin after taking of a food, it will reduces the action, it will reduces, it will decreases the absorption. And if I am taking the glucinoflavin, is the drug absorption has been increased. So, look at here, the one drug ampicillin and second drug was glucinoflavin. So, the food definitely will interferes the absorption. If I am giving the ampicillin drug, it will reduces the absorption and glucinoflavin will enhances the absorption. So, the drug it depend upon the drug, what the drug you are giving with the food, right. So, here definitely the food, the diet will modifying the drug action. If I am taking the ampicillin with the diet, it is going to decrease the absorption of any drug. And if I am taking the drug like glucinoflavin with the food, it is going to increase the absorption inside the body. And the next one, generally the food decreases the rate and extent of absorption. For example, if I am taking the anthelmintics, you should not mix with the food stuff. So, definitely the you have to prevent with the food stuff. When you are taking the antihelminthics, you should not take with any food stuff. And the example like penicillin V, when you are taking the penicillin V, it will causes the inactivation in the stomach. So, to prevent the drug inactivation, you should not take with the food. Example was penicillin V. And if you are taking the drugs like motion sickness drugs, to get the fast action, you should not mix up with the food or you should not mix up with the diet. And next factor of modifying drug action was time of administration. At which time you are going to administer the drug, it will plays an important role here. So, the drugs you have to administer, some drugs you have to administer before at the empty stomach, and some drugs you have to administer after the food, and some drugs you have to administer at the night time, and some drugs you have to administer at the daytime. So, for example here I had given like antacid, right. Antacid is a drug which will neutralize the HCl and which you have to take at the empty stomach. So, after taking of food also it definitely can neutralize the action, but not such an extent which you had taken with the empty stomach. The action with empty stomach will be much more better than taking of a drug with the food. And next one is hypnotics. Usually you can take hypnotics at night time. If you have taken the hypnotics at the daytime, due to because of day disturbances, you cannot get the sleep properly. So, definitely the time of administration also will modify the drug action. And next one is genetic influence. Definitely the genetic influence will modify the drug action. Here there are some follows which will causes the genetic influence modifying the drug action. For example, students, here if any particular person taking the succinylcholine, if you are the particular person who is following with the succinylcholine and who having the atypical cholinesterase, then what is going to happen? You can see the prolonged aponia, shortness of a breath during the night times. You can see the shortness of breathing in night times when you have been followed with the succinylcholine, and who particular person having the lack of, or who particular person having the atypical cholinesterases. Okay, next one, you can see the slow and fast acylation of any drugs such as isoniazid, hydralazine and dapsone. So, in genetic due to because of genetic influence, some drugs are going to show the fast acylation, some drugs causes the slow acylation. And the next one is phenytoin. Phenytoin usually it will causes the nephrotoxicity. When it can causes the nephrotoxicity, if the particular person who having deficient of peroxidase activity. So, who having the hepatic microsomal peroxidase activity deficiency condition, the phenytoin is a drug, definitely it is going to cause the nephrotoxicity. So, this is also one of the genetic influence which will cause it by the drug. So, these are all the factors which are going to modify the drug action. And next one, pregnancy. The pregnancy is also one of the important factor that going to modify the drug action. We have to take the special care while we are administering the drugs to the pregnancy person. Here we should not administer the uterine stimulant drugs. You should not give the uterine stimulant drugs to the pregnant woman. It is contraindicated. You should not give to the pregnancy woman. And the drugs like methotrexate, angiotensin converting enzyme inhibitors, anticholinergic drugs, non-steroidal anti-inflammatory drugs, phenytoin, tetracycline, valproic acid, warfarin, like anticoagulant drugs, all these drugs have been proven effect which causes the teratogenic action. So, all these are the drugs you should not prescribe to the pregnancy woman which can causes the teratogenic action, and should not use the uterine stimulant drugs which are contraindicated in the person, in the pregnant person. So, if I am talking about the pregnancy condition, especially in the third trimester, there is going some slightly changes in absorption, distribution, metabolism and excretion. If I am talking about absorption, so here we will discuss about absorption, distribution, metabolism and excretion in the third trimester of a pregnancy woman. So, what is going to happen in absorption? So, in the third trimester of a pregnancy condition, the absorption definitely will interfere with the drugs. So, what will happen in this pregnancy state? Here the absorption, the GI motility will be get decreased. So, the GI motility will be get decreased in the pregnancy woman. And what about the distribution? Due to increase in plasma volume, due to increase in plasma extracellular volume, the drug will be get very much distributed in the body. The distribution will be get increased, right? And next one, metabolism. Due to induction, due to the induce of an hepatic microsomal enzymes in the third trimester of a pregnancy, the drug can be metabolized very fastly due to because of enzyme inducers. And what about the excretion? Here the renal blood flow will be get increased in the third trimester condition. Here if the renal blood flow increases, the elimination of a drug will be get fastened. The drug can be eliminated very fastly from the body. So, the distribution is very fast, distribution is very more, metabolism is fast, excretion is also will be eliminated very fastly from the body, and absorption will be get here absorption, intestinal motility will be get decreased in the pregnancy state. Here FDA has been rated according to the toxicity to the particular woman who having pregnancy. So, here FDA has rating. Here they had given the rates like A drugs, B drug, C drug, D drug and X drug. So, depending upon what the drugs you are taking here and what the condition is going to happen here. For example, folic acid. Folic acid is a drug when you had administered, it do not show any risk in the pregnant woman. So, this type of drugs has been kept in A group, right. And the second one is metronidazole. No evidence has been proved in animals, but it has been shown the toxicity effect, heterogenetic effect in the animals. Okay, and the most of the drugs risk cannot be ruled out. You cannot rule out the risk. What type of risk is going to happen with a particular drug? So, you cannot, if you are not going to rule out the drugs, this type of drugs has been put in the C. It had been it has been rated as an C. And next one, anti-epileptic drugs, it having the positive evidence to the risk effect. It has been proven that this drug having the positive evidence, it can causes the teratogenic action. So, the proved effect of such a drugs has been put in the rating of D. And the last drug was cytotoxic drugs, methotrexate, okay, warfarin, etc. All these are the drugs absolutely you should not given to the pregnant woman. These are the drugs. What are the drugs? Which are the drugs going to cause the cytotoxic action? Which are the drugs who are going to cause decreasing the immunity function? Immunosuppressant drugs like methotrexate, anticoagulant drug, warfarin. Definitely these drugs are contraindicated to the pregnant woman and which will be rated as any X drugs. so which had get given as an X drug. So there are some drugs which has been categorized into A, there are some drugs which has been categorized into B, and some more drugs as in C, and some drugs as in D, and finally contraindicated drugs as an X. And next factor was the physiological state. Definitely the physiological state will plays an important role to modify the drug action. Here the particular patient do not having any problem, but still he will believe here what is going to happen depend, here the patient have any faith or believe on the doctor drug, what the drug had been given by the doctor. So the doctor knows that here the particular person do not having any problem, but he needs the drug. So what the doctor will do here, the doctor will prescribe the dummy drug, the placebo drug. Here there will be no active chemical inside the drug, but what the patient will think here, he went to the he had visit to the doctor and doctor has prescribed the drug, and he having a psychological feel that after taking of the drug he had been cured. So in such a psychological feeling also, that drug is going to modify the drug action. Here the inert substance, here the doctor cannot give any inert substances instead of inert substances, here doctor will give some here the doctor cannot give any active substances, instead of active chemical here he will give a placebo drug. And next one was cumulation. What it means? The administration of a drug is more than elimination. For example, if you are administered the drug first dose, so for example, if a doctor has been said the drug to take that 3 times a day, so first dose you are taking at a morning, and second dose you are taking at an afternoon, and third dose you are taking at a night time when you are going to the bed, right, and you have taken the 3 doses of a particular drug. So when you can see the cumulative effect, the administration of a drug is more than the elimination of a drug. You had taken the first dose at the morning, and which has been not eliminated from the body, and you had taken the second dose and the administration has been increased because the first dose has not been eliminated from the body, and now you had taken the third dose also. The administration of a dose is increased when and the rate of elimination has been decreased, then you can call as an accumulation effect. So the best example was chloroquine. And the next one, disease state. The disease state also will play a very important role here. Here we will say the 5 disease state like GIT, liver disease, kidney disease, heart failure, and thyroid condition. Right. So first we will discuss about the disease type like GIT disease. So what is going to happen in GIT disorder? So if any particular person who having the GIT disorder, how the drug is going to modify the drug action. For example, here I am taking the 2 disorder like a celiac disorder, and second one is achlorhydria. So here one type of a drug, so depending upon the condition of a disorder, definitely the drug is going to modify the drug action. For example, if I am giving the amoxicillin antibiotic, like if I am giving the antibiotic like amoxicillin or any vitamin capsules like A, D, E and K. And here what is going to happen here, the absorption of a particular vitamins will be decreased in this disease condition. So if any particular person having this celiac disorder, if doctor has been administered the vitamin A, vitamin D, E and K, what is going to happen here? Because of this disease state, the absorption of the particular drug will be get decreased. And what is the second one condition? Achlorhydria. And what will be going to happen here? Aspirin absorption will be get delay. At this disorder condition, the aspirin absorption will be get delayed. It will get delays with that disorder condition. And next one, liver state. Due to the first pass metabolism of nitroglycerin, salbutamol, warfarin, salbutamol, verapamil will reduces, thereby the toxic level will be increased in the plasma. So what is going to happen here, if particular person who having the liver disorder, so liver function will be get delayed. So liver function has not been properly well seen with the particular person. So here the particular person who having the liver disease, who not functioning the liver, who do not having the function with that liver. So what is going to happen here? So if I had administered the nitroglycerin drug or salbutamol drug, so these drugs cannot be metabolized by the liver. If the drug cannot metabolize by the liver, here the free form of a drug will be increased inside the body, and which will causes the toxicity action also. And next one, kidney state, and what is going to happen if the any particular person who having the kidney, who having the excess of who having the kidney failure condition, in such a condition what is the kidney will do, it will excrete the albumin. So albumin is particularly specific to the acidic drugs. So acidic drugs will go and bind to the albumin. Now the albumin will be excreted in the disorder condition like kidney. So the free form of acidic drugs will be seen inside the body, which can causes the toxicity. And thyroid condition also, you can see the hypothyroidism and hyperthyroidism. In hyperthyroidism condition, it can shows the resistance to the inotropic action of any digoxin drug. And if I am talking about hypothyroidism condition, if you are administered with the CNS depressant, morphine or digoxin, it can shows the sensitive action. Okay, and heart failure, definitely it can shows the sensitivity of a positive inotropic affection of a drug like a distalis. And next one modifying was race, and here there are some examples and what it is going to modify the drug action. So rabbits, it can tolerate the atropine, rats is resistant to the distalis. So beta blockers are less effective to the Caribbeans, right? And the next one is tolerance. The tolerance has been classified into natural and acquired tolerance is further classified into acute and chronic. And if I am talking about the chronic, it is further classified into pharmacokinetic, pharmacodynamic and cross tolerance. So what is a natural tolerance? Naturally the tolerance has been produced inside the body. For example, rabbits are tolerant to the atropine. And what is an acquired tolerance? As the repeated dose you had given to a particular drug, individual can causes the acquired tolerance. So this is happen with the repeating administration of a drug. Thank you.